Metformin is one of the most trusted and widely used medications for managing type 2 diabetes. For millions of people, it's a key part of keeping blood sugar in check and preventing long-term complications. But like every medication, it's not without its downsides. While many side effects are mild and temporary, others can be more persistent, and a few can be serious if ignored. The problem is that some of these side effects are easy to mistake for everyday issues, like feeling tired, having an upset stomach, or noticing subtle changes in your body. Without knowing the connection to your medication, you might overlook the early warning signs. In this video, we'll go through 8 side effects of metformin you should never ignore. You'll learn what causes them, how to spot them early, and when to bring them up with your doctor. This isn't about scaring you. It's about giving you the knowledge to protect yourself and get the most benefit from your treatment. So let's begin with one of the most common and often most frustrating side effects, the digestive issues that many people experience when starting metformin. 1. Digestive issues, nausea, diarrhea, stomach pain. One of the most common side effects of metformin, especially when you first start taking it, is digestive discomfort. This can include nausea, diarrhea, stomach cramps, bloating, or a general uneasy feeling in your gut. For some people, these symptoms fade after a few weeks as the body adjusts, but for others, they can be ongoing and disruptive. Metformin works by improving the way your body responds to insulin and lowering the amount of sugar produced by your liver. But it also affects the way your intestines absorb certain substances, and this can lead to changes in gut motility. Essentially, food and fluids may move through your digestive system faster than before, which is why diarrhea is so common. The discomfort often appears within hours of taking your dose, especially if you take it on an empty stomach. That's why many doctors recommend taking metformin with meals. It helps slow absorption and can reduce irritation in the stomach and intestines. While mild digestive upset is usually harmless, persistent symptoms can interfere with daily life and nutrition. Chronic diarrhea, for example, can lead to dehydration or weight loss, and constant nausea may make it harder to eat balanced meals, which is crucial for managing diabetes. Extended release, versions of metformin can sometimes reduce these side effects as the medication is absorbed more slowly. Adjusting the dosage gradually rather than starting at a high dose can also make the transition easier. However, if digestive issues are severe, prolonged, or accompanied by other symptoms like fever or blood in the stool, you should seek medical advice right away. These could signal a more serious problem or an intolerance to the medication. Metformin should support your health, not make you dread every meal. Recognizing and addressing digestive side effects early can help you stay on track with your diabetes care without sacrificing your comfort. 2. Vitamin B12 deficiency. One of the lesser-known side effects of long-term metformin use is vitamin B12 deficiency. This isn't something you'll notice overnight. It develops slowly, often over several years, which is why it can be easy to miss. Metformin can interfere with the absorption of vitamin B12 in the small intestine. Over time, this gradual decrease can lead to low levels of the vitamin, which plays a vital role in nerve function, red blood cell production, and brain health. The early symptoms can be subtle: occasional tingling in the hands or feet, slight numbness, or a feeling of weakness. As the deficiency progresses, you might experience persistent fatigue, memory problems, difficulty concentrating, or even changes in mood like irritability or depression. Some people also develop a smooth, sore tongue or notice that they feel short of breath more easily. Because these symptoms can be mistaken for aging, diabetes-related nerve damage, or other health conditions, many people don't realize their B12 levels are low until a blood test reveals it. That's why regular monitoring is important, especially if you've been on metformin for more than a few years. If your doctor finds your B12 levels are low, the solution is usually straightforward: dietary adjustments, oral supplements, or in some cases, B12 injections to quickly restore healthy levels. Foods rich in B12 include meat, fish, eggs, and dairy products. Though if absorption is the issue, supplements may be necessary. Addressing B12 deficiency early is crucial because prolonged low levels can cause permanent nerve damage. If you're on metformin, ask your doctor to check your B12 levels every year or two as part of your routine blood work. Metformin can be an effective tool for controlling diabetes, but keeping an eye on your vitamin status will ensure your medication isn't silently harming your long-term health. 3. Lactic acidosis, rare but serious. Among all the side effects of metformin, lactic acidosis is the rarest, but also the most dangerous. It occurs when lactic acid builds up in the bloodstream faster than the body can remove it. While it happens in less than 1 in 100,000 patients, it can be life-threatening if not recognized and treated immediately. Metformin lowers blood sugar partly by reducing the amount of glucose your liver produces. But in rare cases, this process can interfere with how your body breaks down lactic acid, especially if your kidneys are not working at full capacity. When lactic acid levels rise, it disrupts the body's pH balance and can damage multiple organs. The symptoms can appear suddenly and may include deep, rapid breathing, severe weakness, extreme fatigue, muscle pain, stomach discomfort, and a feeling of being unusually cold. Some people also experience dizziness, confusion, or an irregular heartbeat. These signs should never be ignored, especially if they develop after illness, dehydration, or surgery, all of which can increase the risk. Certain conditions make lactic acidosis more likely, including kidney disease, liver disease, alcohol abuse, or heart failure. That's why doctors usually avoid prescribing metformin to people with these health problems or stop it temporarily before major surgeries or medical imaging procedures involving contrast dye. If you ever suspect lactic acidosis, it is a medical emergency. Stop taking metformin and seek immediate hospital care. Treatment typically involves supportive measures to restore the body's acid-base balance and address the underlying cause. While the chances of lactic acidosis are extremely low, being aware of it can save your life. Metformin remains a safe and effective medication for most people, but only if you and your healthcare provider watch for rare yet critical reactions. 4. Low blood sugar, hypoglycemia. Metformin on its own doesn't usually cause dangerously low blood sugar, but when combined with other diabetes medications, like insulin or sulfonylureas, the risk of hypoglycemia increases significantly. And for anyone managing diabetes, low blood sugar is something to take seriously. Hypoglycemia happens when blood glucose levels drop below what the body needs for normal function, usually under 70 mg/dl. Without enough sugar in the blood, your brain and muscles don't get the fuel they need, and symptoms can develop quickly. The early signs are often easy to miss: feeling shaky, breaking into a cold sweat, sudden hunger, or a racing heartbeat. Some people also notice tingling around the mouth, blurred vision, or irritability. If blood sugar continues to drop, more severe symptoms like confusion, slurred speech, clumsiness, or even loss of consciousness can occur. Low blood sugar can be triggered by skipping meals, exercising more than usual without adjusting your food intake, drinking alcohol, or taking too high a dose of diabetes medication. Older adults may be especially vulnerable because their bodies respond more slowly to changes in glucose levels. If you experience symptoms, check your blood sugar right away. If it's low, the fastest way to treat it is the 15-15 rule. Consume 15 grams of fast-acting carbohydrate, like glucose tablets, juice, or regular soda, then recheck your blood sugar after 15 minutes. Repeat if needed until your levels are back to normal. Preventing hypoglycemia starts with awareness. Always take metformin and other diabetes medications exactly as prescribed, and try not to skip meals. Keep healthy snacks or glucose tablets on hand, especially when you're out or exercising. Managing diabetes is about balance, lowering blood sugar enough to stay healthy without letting it drop so far that it becomes dangerous. Knowing the signs of hypoglycemia and how to respond quickly can help you stay safe while getting the benefits of your medication. 5. Unexplained fatigue. Feeling tired is a part of life, but if you're on metformin and notice that exhaustion lingers no matter how much you rest, you may be dealing with unexplained fatigue related to your medication. This type of fatigue can come from several factors. For some, it's linked to low vitamin B12 levels, which we discussed earlier. For others, it may be related to fluctuations in blood sugar. Even small drops that don't reach the level of hypoglycemia can leave you feeling drained. Metformin also changes the way your body uses energy at the cellular level, which can sometimes cause a subtle but persistent sense of tiredness. The fatigue can show up in different ways. You might feel heavy and sluggish during the day, have trouble staying focused, or find that tasks you once did easily now seem overwhelming. Some people also report a general sense of weakness, like their muscles aren't responding as well as they used to. What makes this symptom tricky is that fatigue is common in diabetes itself, as well as in many other health conditions. That's why it's important to pay attention to timing. If the fatigue started or worsened soon after beginning metformin, that's a clue worth sharing with your doctor. Keeping a daily energy log can be helpful. Note your sleep quality, meal times, medication schedule, and energy levels throughout the day. This record can reveal patterns and help your healthcare provider decide whether an adjustment to your dose or timing might help. In some cases, switching to an extended release version of metformin or making small changes to your diet and exercise routine can improve energy levels. And if vitamin deficiencies are involved, supplements may make a noticeable difference. Your diabetes treatment should help you live a fuller life, not leave you running on empty. If unexplained fatigue is holding you back, addressing it early can help you regain your strength and independence. 6. Muscle pain or weakness. Some people taking metformin notice an unusual symptom that doesn't immediately seem connected to diabetes medication: muscle pain or weakness. While it's not the most common side effect, it can be linked to how the drug affects energy production in muscle cells. Metformin works by altering the way your body uses glucose and how your liver produces sugar. In rare cases, these changes can slightly reduce the availability of energy for your muscles, leading to soreness, cramping, or a feeling of heaviness. The sensation may be mild at first, like post-exercise soreness, even if you haven't done anything strenuous. Over time, however, some people find it harder to do activities they once managed easily, such as climbing stairs or carrying groceries. Another possible factor is lactic acid buildup, not to the dangerous levels seen in lactic acidosis, but enough to cause discomfort and fatigue in the muscles. If you also notice shortness of breath, unusual tiredness, or swelling, it's important to get checked promptly. Muscle weakness can also be a sign of low vitamin B12, which we discussed earlier. This is another reason why regular blood tests are important if you've been on metformin for years. To help manage mild muscle symptoms, make sure you're staying hydrated, eating enough protein, and engaging in gentle physical activity to keep your muscles strong. Stretching and light resistance exercises can improve circulation and reduce stiffness. However, if muscle pain or weakness is sudden, severe, or getting worse, talk to your doctor immediately. They may run tests to rule out other causes, such as thyroid problems, electrolyte imbalances, or interactions with other medications. Muscle strength plays a huge role in maintaining independence, especially as we age. By catching and addressing this side effect early, you can protect your mobility and keep doing the activities you enjoy. 7. Changes in taste, metallic taste in mouth. One of the more unusual, and sometimes frustrating, side effects of metformin is a change in taste, often described as a persistent metallic or bitter flavor in the mouth. While this isn't harmful in itself, it can affect your enjoyment of food and even your appetite. This change in taste, known as dysgeusia, happens because metformin can alter the way your taste buds and nervous system process flavor signals. It's not fully understood why this occurs, but researchers believe the drug may slightly affect certain receptors in the mouth or influence the way your brain interprets taste. For some people, the metallic taste is mild and only appears right after taking the medication, fading within an hour or two. For others, it can linger throughout the day, making favorite meals less appealing. In some cases, it's accompanied by a dry mouth, which can further change how flavors are perceived. While not dangerous, this side effect can lead to reduced food intake, which isn't ideal if you need consistent nutrition to manage diabetes. It can also be discouraging if eating becomes less enjoyable. There are a few simple ways to manage it. Taking metformin with food or milk can help reduce the metallic aftertaste. Drinking more water, Chewing sugar-free gum or sucking on sugar-free mints can also refresh your palate. Some people find that rinsing with a mild mouthwash after taking the medication helps. If the taste changes are severe or causing you to lose your appetite, let your doctor know. Sometimes switching to an extended release form of metformin or adjusting the timing of your doses can reduce the symptom. While a metallic taste isn't a serious health threat, it's still worth addressing, not just for comfort, but because eating well is a vital part of diabetes management. Keeping your meals enjoyable means you're more likely to stick to a healthy eating plan. 8. Allergic reactions: rash, swelling, itching. Although rare, allergic reactions to metformin can occur, and they should never be ignored. Allergies to medication can range from mild skin changes to severe, potentially life-threatening symptoms. The most common signs are skin-related: a red, itchy rash, hives, or patches of irritation that may appear anywhere on the body. Sometimes swelling can develop in the face, lips, tongue, or throat. This is known as angioedema and can be especially dangerous if it interferes with breathing or swallowing. Other symptoms of an allergic reaction may include dizziness, rapid heartbeat, or difficulty breathing. These reactions usually occur soon after starting the medication, but can appear at any time, even after months of use. The exact cause of allergic responses to metformin isn't fully understood, but they may involve the immune system misidentifying the drug as a harmful substance. While mild rashes can sometimes resolve on their own, any sign of swelling in the face or throat, or difficulty breathing, is a medical emergency and requires immediate attention. If you suspect an allergic reaction, stop taking metformin and contact your doctor right away. Severe cases may require urgent treatment in a hospital, including antihistamines, corticosteroids, or even epinephrine for life-threatening reactions. Once you've had an allergic response to metformin, it's generally not safe to restart the medication. Your doctor will likely recommend switching to a different diabetes treatment. Being aware of the warning signs and acting quickly can prevent a mild reaction from becoming dangerous. Even though allergic reactions to metformin are rare, knowing how to spot them could save your life. Metformin has helped millions of people manage type 2 diabetes and reduce their risk of serious complications. But like all medications, it comes with potential side effects, some mild, others more serious. We've explored 8 important ones: digestive issues, vitamin B12 deficiency, lactic acidosis, low blood sugar, unexplained fatigue, muscle pain or weakness, changes in taste, and allergic reactions. Recognizing these symptoms early can make all the difference in staying safe and healthy while on treatment. If you notice any of these effects, don't stop metformin on your own. Instead, keep a record of your symptoms, how often they occur, and any possible triggers. Share this information with your doctor so you can find the safest and most effective way to manage your diabetes. Remember, your health is about more than just numbers on a blood test. The right treatment should support both your physical comfort and your long-term well-being. If you found this video helpful, please like it, share it with someone who might benefit, and subscribe to MediMint for more clear, reliable health advice designed especially for people over 50. Your health matters. Let's protect it together.